of this news comes out right as we head into Thanksgiving, the holiday season. What's the CDC advising people to do for the holiday? Take us through that again.
So more than half of Americans are saying that they are planning on traveling for Thanksgiving. And we're hearing that that's going to be a big concern for public health officials. Now, the most important thing that the CDC is stressing here is that people who do gather for the holidays stick within their household. Now, what does that mean? Basically, it means that people are going to have to stick within the people that they actually live with day to day. It's not going to mean that people are able to see, for example, their children who are in college, right? If you're related, that doesn't matter. It means you want to hang out with people who are in your actual household. And I spoke with a coronavirus survivor yesterday about her experience with the virus and also the pressure that she's put on herself to kind of teach her family members about the importance of taking COVID seriously ahead of Thanksgiving. So I want to give us a listen into what she had to say about the severity of the virus heading into the holidays.
Thankfully, I'm mostly recovered from COVID. I had long COVID, as we call it, for about 3 months from March 13th through early June. And I'm one of the lucky few that, got mostly better after that. So in that time, of course, I started a COVID-19 patient support group. I started writing pretty extensively on the COVID-19 patient experience. I can only stress that COVID, is not a mild flu for many, and that the effects of COVID, it impacts all systems of the body, but it also impacts all areas of a patient's life. So, that means financial health, emotional health, mental health, physical health, your relationships with others, especially, if you end up being one of these long haulers, the effects are really long term.
What is a COVID long hauler? What is that like?
So COVID long haulers, also sometimes referred to as long COVID patients, are people who contract COVID and remain sick for more than 2 to 4 weeks. So that includes folks like myself who were sick for 2 to 3 months and eventually recover. It also includes those who have been sick for 6, 7, 8 months and are not getting better. Now that we're getting a little further on in the pandemic, we're starting to see sort of what long COVID looks like 6, 7, 8 months down the line. We're still not really sure what this condition is going to mean long term. And of course, there are still people who have not received other diagnoses, and doctors are still quite confused about what exactly is causing kind of these long-term symptoms. But that's typically the way that we define long haulers.
And I'm wondering, you're gathering so much data through this support group, right? So what are some themes that have emerged for you or some learnings that you can tell us just about the experience of having COVID-19?
So some of the research that we've done and some of the other research emerging elsewhere has shown a couple of interesting things. So the first thing is that long COVID is not rare. The CDC has estimated that approximately 35% of non-hospitalized patients report not feeling better after 2 to 4 weeks. So that's a pretty significant portion of COVID patients. And we also have to assume that it's perhaps a larger percentage than that, since there are many COVID patients who never test positive for the virus and are thus not counted as patients. In our support group, it comes up again and again, people kind of being upset about seeing folks without masks, seeing folks congregating. And I think our hope is that with a new administration, we will see better policy decisions from the top down so that, again, this burden of choice is not solely placed on the individual level.
Madison, thank you so much for that report.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quicktake now for insight in an instant.